All right. Welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, we're going to go into a little bit of a different topic and talk about some of the after effects of a concussion or maybe multiple concussions. That's why we're going to talk about PCS or post concussion syndrome. Like always, sources will be at the bottom of the screen or in the description below. I highly encourage people to look at that. Also, we'd appreciate your feedback. Feel free to subscribe to the channel. We try to keep this educational and but also very applicable. So also we'd appreciate if you like this video as well. But with that being said, we do have a lot to get into and a lot of interesting topics within this topic to cover. So let's get into this. So what is post-concussion syndrome? Well, per the definition, according to Stat Pearls, they're always a wonderful resource for clinical terminology. Post-concussive syndrome is what they call, and I'm quoting them on this one, the constellation of symptoms that commonly occur after a mild traumatic brain injury. Now, since that is a mouthful, we'll say this bullet point right here, unresolved symptoms from a brain injury. We typically do see this as self-reported symptoms that persist for a period of time greater than a few weeks. And so we're talking about a lot of symptoms that just keep coming back or they just never leave. And so this is how we get post-concussion syndrome is that these symptoms, again, it's a constellation, which means that there's quite a variety of them out there. Um, they are commonly occur after the brain injury, after the traumatic brain injury, the blow to the head. And we see that, yes, they're self-reported, but they last a long time, longer than expected or longer than someone would want. Um, and usually they're unresolved. So that wraps up what the definition is. Let's move on and let's talk about the causes of post-concussion syndrome. Well, what we see in this image here is two football players colliding and their heads hitting together. And what we see is, yes, acceleration and deceleration injury. You can get that from a car accident as well, but we're mainly talking about physical blows to the head. And as we can see here, these football players, um, they are causing each other blows to the head. Fortunately, they are wearing helmets, but you can still get a concussion from, you know, having the blow to the head, even with a helmet on, even though it might reduce the severity. It can also be caused by rotational injuries. Not all brain injuries are front and back or side to side. Maybe it's twisting the brain. Maybe the brain is turning within the skull. We also see this common with sports activities and other kinds of active injuries. For example, like my former profession, the military, you could see this a lot with ground fighting, wrestling. You probably see this a lot in football, maybe soccer if they're hitting the ball with their head, maybe even hockey, or maybe even NASCAR races. Um, but we're seeing it to where it is a lot of concussion activity, a lot of those kind of activities can cause post-concussive syndrome. And we can also see that this causes injury to deep tissue structures like the corpus callosum, which is one of those structures which I should cover in another video. The corpus callosum is one of those deep tissue structures that connects the both sides of the brain. So what we see here is that this can be caused by a variety of different things, including a car accident, maybe a football game, maybe military wrestling, maybe NASCAR. Uh, but what we see is that this can happen to practically everybody if they get in the unfortunate wrong situation of being in a car accident. Well, let's move on and let's talk about the symptoms. We do see that the common symptoms, they're usually divided between behavioral and mental health, or maybe they're having cognitive difficulties or metabolic or physical changes. I found this really good graphic to the right side of the screen here, and it kind of sums up what some of these things are, like headaches. If you get hit in the head, your head is probably going to ache after that. But headaches, if they last a lot longer than someone would be expecting, maybe they're lasting a couple of months, maybe they're just not going away. Maybe after that injury, you start getting dizzy more often. Maybe you find yourself more dizzy than usual. Again, sensitivity to light and noise. Some people are that way from the very get-go, but maybe the brain injury makes it worse. Or maybe they weren't that way prior to that concussion, and then now maybe they need to turn the lights down a little bit. Maybe they need to put on some noise canceling headphones. Maybe they're more sensitive to that. We also might see that there might be problems with sleep. Maybe their appetite changes one way or another. It could be, over or under eating. If your brain is always fatigued, maybe that's a symptom of the concussion. Also, it just like a car engine, if it's damaged, it's not going to work properly. Well, trouble concentrating. That's a cognitive thing. Also, talk about memory, the depression and anxiety that could be common. Um, but these kind of tie into like the symptoms that persisting longer than one might expect, or maybe of greater than a few weeks. And if someone is still having the difficulty with memory, or maybe their concentration is slowed, maybe their concentration is a lot smaller, maybe their time frame of that concentration is a lot smaller, or maybe they're having some executive dysfunctioning. Maybe they're making an impulsive decision, or even possibly if they are making, other decisions that aren't their norm. And again, that's quite possible with post-concussion syndrome. You might also see slowed reaction time and slowed decision making. That would be kind of tied in with the fatigue, where the information is not getting to your brain to and from as fast as it would have prior to the injury. We might also see the metabolic and physical changes. Again, that sensitivity to light, the technical term is called photophobia. And so, photo being light, phobia, which is kind of afraid of. Um, Sometimes it's too bright in a room to, for that person with post concussion syndrome. You might also see other common symptoms like nausea, vertigo, which might be causing the nausea, maybe dizziness causing the nausea, or maybe it's fatigue. Maybe the brain is not working at 100% and needs to rest. And so those are things to consider. What are the common symptoms that might happen not only after a concussion, but what might happen long term after a concussion? So let's move on. And what do we know about this diagnosis? Well, there are multiple studies that indicate changes post-injury. Those changes that we talked about, changes in metabolic changes, structural changes, emotional and cognitive changes. They have found that there are some biomarkers, which is a fancy term of observable facts. They are noted and observed, and you can find them and their objective findings. Maybe there's a test like the Iowa gambling test. After the PCS, um, they might return back to normal, but maybe during that PCS period, maybe the Iowa gambling test shows that more risk-taking behavior. That's just one example. Maybe they fatigue much quicker. Um, we also see that disruptions in the brain activity would exist. So that kind of ties in with the cognitive effect, where they might be able to focus on a task for 10 minutes, but then maybe squirrel gets distracted. And what we also saw in this article down here is that MRI is being more prevalent in the diagnosis and treatment of post-concussive syndrome. They're starting to find those abnormalities. They're able to identify where that abnormality is. Maybe someone who used to be talkative now is a whole lot quieter. They might be looking in that temporal lobe for other kinds of damage. MRI is a great tool for clinicians. And so those are things to keep in mind when we think about, okay, what do we know corporately about post-concussive syndrome? What does this lead me as a brain injury case manager to conclude? Well, first, I know it says mild traumatic brain injury, but it's more than just getting your bell rung. That's the point of this article down here. Um, we shouldn't just say the person got his bell rung. It's a TBI. It's a traumatic brain injury, even if it is classified as mild due to the Glasgow Coma Scale, which is from 3 to 15. If they have a good score, like 13 to 15, again, according to that article, um, it might be classified as mild, but it's still a traumatic brain injury. So these symptoms that come from concussions, they can persist for a very long time. They might not ever go away, or maybe they stay around for a while. Obviously, one of my biggest points is let's prevent the brain injury from the start. If you're going to be playing a game, wear the proper attire. If you're going to go out for that bike ride, you're going to wear that helmet. If you're going to go drive your vehicle or ride in a vehicle, put on your seatbelt. You want to prevent that brain injury, but you also want to know the symptoms. It might encourage you to put on the seatbelt or wear the helmet. But most importantly, it's not just a concussion. It's not just getting your bell rung. It's not necessarily just that it's a mild traumatic brain injury or these symptoms are common or that they might be persistent a little bit. It's a brain injury. Post concussive syndrome comes from a brain injury. Um, just because it says mild doesn't necessarily mean that what comes afterwards will be mild. Photosensitivity is one of those things where I know it seems small, but when you have that large amount of light coming in, it really does affect the brain. That's why I always tell people try to sleep with your TV off at night. Uh, this is all coming from a brain injury. And that leads me to say, yes, prevent the brain injury, but it's not just mild traumatic brain injury, it's a traumatic brain injury. So, with that being said, those are my conclusions. Here are my references. I hope everyone has a wonderful day. I would encourage you to look up these references. They're very interesting reading and they're all scientific and peer-reviewed sources. They're very well written. I would always encourage that. Also, if you'd like to leave some feedback, we'd appreciate it. If you like this video, give it a good thumbs up. Also, maybe subscribe to the channel. We put out this information weekly. We try to keep it informative, educational, but also applicable to daily life. Also, feel free to leave a comment down below if you have a topic you want us to cover. But with that being said, I hope everyone has a wonderful day and don't forget, protect those brains.